Hi, I'm Dr. Anupama Bappal from Bangalore, and today I'm here to share my experience on counseling for retinopathy of prematurity. So in the next few slides, I would explain to you what is that we do pre-examination, what is a counseling, or what we inform the parents before ROP screening, counseling post-screening, and counseling before treatment. And it's very important to understand that eye examination in children who are born premature is unending and it is a lifelong process. So, as we all know, pediatrician's role in counseling is absolutely important because the parents trust pediatricians. So, and the pediatricians educate the family about ROP before they meet ophthalmologists, and they're very, very important part of the counseling. Even before when I decide regarding treatment for retinopathy of prematurity in a baby, I inform the pediatrician first because the parents would invariably call the pediatrician to ask, is the treatment required? I mean, is it really required? So then pediatrician will not be in a position to counsel if I haven't given them any information. So if I have given them information, yes, it makes a lot of difference. The pediatrician is ready and he would counsel the parents about the need for treatment. So a pediatrician is the person who take care of the newborn, and they also give reference for ROP screening. So as long as the baby is in the neonatal intensive care unit, it's not a problem because ophthalmologists would go to the NICU and take care of the baby. We screen them and we counsel them. But if the baby is out of an ICU and the pediatrician has advised the parents to take the baby to the ophthalmologist, there might be a possibility that the parents would not have understood, or they may not have taken the screening very seriously, and they would have decided not to consult an ophthalmologist. So to make sure that the parents understand the message that ROP screening is absolutely a must, we can share a video on awareness video on ROP screening, there are beautiful videos available on YouTube which could be shared with parents. It's just 1 or 2 minutes video. So the counseling continues beyond hospital premises. So what do we inform parents before ROP screening? So we tell them that we would use some eye drops into baby's eye. We would use a simple instrument to keep the eyes open. We will gently move the eyes so that the entire retina is examined. And there is a small possibility that the baby's eye would turn red and baby would definitely cry. Now, this is what disturbs them a lot. And a small word, a pediatrician could also inform them that the ophthalmologist would use some instruments during eye examination, and there's a possibility that the eye would become red and the baby would cry. So then they would accept screening more easily. So it's one such WhatsApp message where the mother was reluctant to use the drops, and I had to tell the mother that retinal examination cannot be done without the use of eye drops. Another parent was worried because there was a small red dot following examination, and so had to convince her that it's okay, it would just disappear in 7 to 10 days, it would just fade off, so not to worry. So how do we counsel post-screening or post-examination? Parents are already stressed. Child is just, first screening is done at 2 weeks. So the child is small, child is in the NICU, baby is struggling to survive, parents are stressed. So I tell the parent first that your baby is fine. So that reduces their stress level and they are in a position to kind of listen to me and understand the seriousness of retinopathy of prematurity. So I tell them the baby is fine, but the retina is not completely developed. Baby would require frequent visits, probably more than one visit. And I also explained to the parents that what is retinopathy of prematurity, it's blinding complications, and we give them follow-up cards. As you can see, there's a follow-up card here. We give them date, and they're quite now with the follow-up card. The follow-up has become extremely good. They stick to the date of follow-up, and they do come back to us. So we show them these videos on ROP, which shows what exactly happens in the inner part of the eye, that's the retina. We provide them information on ROP, and as mentioned earlier, I also give them follow-up cards. Now, with this kind of counseling, I thought probably we are doing an excellent counseling. We wanted to know what is the impact of counseling, and when we saw the result, it was quite, we were surprised that only 50% of them understood that ROP can cause blindness, and only 30% of them read the information in brochure. So that's when we decided that we have to convert this information, black and white information on ROP, to a video format, and that's when on World Prematurity Day we released this video on awareness of ROP in Kannada and English. So this is available on YouTube. You can download it and use it. So this video is shared on WhatsApp with parents, and we do tell them to share it with their friends and relatives, so they are not misguided by others. So we can notice that it's usually the parents are willing to get their baby's eye examined and treatment if required, but it's the relatives who are unaware of the disease who misguide them. So watching a video, awareness video on retinopathy of prematurity would also educate them, and even the parents and the rest of the society. The society would know about the seriousness of the disease and would not neglect baby's eye being examined. For those who do not have smartphone, a follow-up card with a front page having a lot of information instead of lot of information, a very little information on ROP would suffice. So this would also inform them that the screening for ROP is absolutely a must because it's a blinding disease. So when we counsel parents on retinopathy of prematurity, we have babies coming from different backgrounds. Socio-economic and understanding is also different. So one such incident happened that the baby's mother could not come to us as she had undergone cesarean section. So that's why the grandmother comes, and I counsel the grandmother, and this grandmother goes back, and she was in tears following counseling. And mother calls me and she asks me what was wrong with my baby's eye, because the grandmother was not able to convey the message. So many times it happens that the parents or the mother will not be able to come for counseling because it would not be possible for her to come. So that's when the relatives or the grandparents would come, and they may not be able to convey the message. So even in such situation, sharing a WhatsApp message, a video awareness video would definitely help in improving the counseling. So counseling before treatment. We do explain the complications of intravitreal injections and lasers. And one such counseling which I learned in a very hard way is that this baby was in the NICU, was under follow-up, and baby was discharged because the baby was fine. So this baby required came for follow-up on an OPD basis, and this baby required treatment. It was an asymmetrical ROP. So we treated the worst type first, and decided to follow up the other eye, and advised the parents to come back to us in 24 to 48 hours. We gave them a date. You will come back after 48 hours. So they do not come back after 48 hours. We call them and they say that yes, they have some other commitments, they are not able to come. We call them again. So they say that they are in Bangalore. So we give them an address of another doctor whom they could go and get the baby's eye examined. They do not do that. They come back to us with at the end of after 3 to 4 months, and the baby has developed advanced ROP in the untreated eye. So when asked, they said that the baby had lid edema and redness. The eye had redness following treatment. So that is why they decided not to treat the other eye. So that was very unfortunate. So for the parents, for an ophthalmologist, it's the the complications would include the visual field defect, the refractive error, and we stress on that. But for the parent, it is the external appearance that matters a lot. Lid edema, redness, discharge would just matter a lot. So it is important to stress on these part of the counseling also, and tell them that it is transient, it wouldn't last for a long time, and please do come back to us because baby requires follow-up examination. So eye examination in children is who are born premature is unending, it's lifelong. So we do tell the parents that the instrument for eye examination, that is an eye speculum, will not be used in future. So when I tell that, they're extremely happy, then good, this will not be used in future. And we also mentioned that the yearly eye examination is absolutely a must. This is for the benefit of the postgraduate students. To make it a little simple, rule of 12, first examination is by 12 days, so that's 2 weeks. Follow up every week, 1 to 2 weeks is follow up is scheduled. Treatment, if at all required, is 1 to 2 months. And please do share the information because it's just 1 and 2 minutes of awareness video. So thank you very much.